Swadika, and very good evening, and welcome to Thai PBS World Tonight. I'm Nad Bunag.
And I'm Hatay Tiranan. And first up on the program tonight, as the COVID-19 pandemic is still spreading in Thailand, 8 more cases of the South African variant of COVID-19 have been found in the Takbai district of Thailand's southern province of Narathiwat, bringing confirmed cases to 11 so far. Medical Sciences Department Director General Dr. Supakit Sirilak said yesterday that the Medical Sciences Center based in Songkhla province had collected an additional 18 samples from Takbai district for testing at the department's request. The center could test only 15 samples, and 8 of them were the South African strain, while the 7 others are of the UK variant. He also said that the 2 samples taken from neighboring Pattani province are not of the South African variant, but more tests must be conducted to determine whether the newly found South African cases are linked to the cases confirmed last week. Supakit said that the genetic decoding of the virus or genome sequencing is more complicated and costly than the RT-PCR test, which can only confirm viral infection but not its variant, and adding that each genome sequencing costs about 30,000 baht and will take about 4 to 5 days to produce a result. The doctor disclosed that all the infections found at the construction worker housing facility at Laksi district in Bangkok are either the UK or the Indian variant, adding that his department will conduct genome sequencing on samples taken from the new COVID-19 infections at Sapan Khao and in Khlong Talat communities to determine the virus strains. He said the department is developing test kits for specific virus variants to be distributed to about 300 authorized labs throughout the country. Meanwhile, Thailand recorded 3,226 new COVID-19 cases today, with 26 more deaths and 3,094 recoveries. This raises the total infections in the latest outbreak, or the third wave in Thailand since April, to now 106,576.
And we can see that in a few months, there are 3 COVID variants that have been detected in Thailand. And although the health authorities insist that mass vaccination will bring the situation under control, the presence of these variants has sparked a lot of fears that the vaccines or the existing preventive measures may not be enough to control the situation. So let's go through the 3 main variants that have been detected in Thailand. First of all, we'll begin with the South African variant, which was first detected late last year. The variant known as B1351 has since spread across the globe, reaching Thailand earlier this month. Reports indicate that the variant arrived here after a Malaysian wife of a Thai man living in the border province of Narathiwat entered the country illegally, skipping mandatory 14-day quarantine. Health authorities in Narathiwat are now trying to control the spread of the variant after the discovery of several more cases. Professor Dr. Thirowat Hemajutha, who heads the Thai Red Cross Emerging Infectious Disease Health Science Center, has warned that this variant spreads fast and blunts the efficacy of most COVID-19 vaccines. However, in clinical trials, 2 doses of AstraZeneca vaccine were found to be only 10.4% effective in preventing mild to moderate infections. And now let's look at the India variant. The first confirmed India variant case in Thailand was reported earlier this month in a pregnant Thai woman who arrived from Pakistan on April 24th. By mid-May, the India variant has infected dozens of construction workers in Bangkok. Deputy Public Health Minister Saathit Pitutesha believes that illegal migrants were responsible for the spread of this variant, but has cited no evidence for this claim. This variant is known as B.1.7, and the India variant has spread very quickly through South Asia, unleashing a tidal wave of infections and overwhelming health systems across the subcontinent. The strain has since been found in several other countries, including the United Kingdom. And although the India variant is highly transmissible, the good news, though, is that the Pfizer and AstraZeneca vaccines, including in the Thai vaccination rollout, are highly effective against the India variant after 2 doses. And another variant that has been detected in Thailand is the UK variant. On this issue, Dr. Yongpo Warawan, a renowned virologist at Chulalongkorn University's Faculty of Medicine, was among the first to declare that the UK variant was behind the COVID-19 infection clusters in Bangkok pubs and bars, which kicked off the third wave early last month. He believes that the variant came to Thailand through Cambodia and is now responsible for most of the COVID-19 cases in the capital and in neighboring provinces. Evidence suggests that the UK variant is 1.7 times more contagious and therefore deadlier than other strains. Moderna, Pfizer, and Sinopharm vaccines have shown impressive efficacy against the UK variant, though the two brands available in Thailand, Sinovac and AstraZeneca, are less effective. The Sinovac jab is barely 50% effective against the normal strain, and its efficacy reportedly drops further in the face of a mutated version. The AstraZeneca's vaccine's ability to prevent symptomatic infections also reportedly drops from 81.5% to just 70.4% against the UK strain. And now that we know all of the COVID-19 variants detected in Thailand, there are many health experts that are worried that there might be a possible Thai variant popping up if the country is not able to control the situation.
Well, let's do hope not that we have a variant from Thailand itself. And of course, with all these many more variants we see emerging in Thailand and in so many other countries, technologies definitely have to play catch up really fast. And
Definitely.
right, infections also happen in clusters as well, that we can see more rapid spreading. People in 7 communities near construction sites in Laksi district in Bangkok are being inoculated against COVID-19 as more infections have been found at Italian Thai development worker housing, bringing total infected construction workers in the area to 1,284. The Bangkok Metropolitan Administration, or BMA, has organized inoculations for the residents in adjacent communities from today until Saturday, with 4,500 doses being administered, as many infections have been found in construction sites, especially the Indian variant. The people being inoculated have already tested negative for the virus. Laksi District Office Chief Sombat Kanok Tipawan revealed that among the 327 Italian Thai construction workers that have been tested, 146 of them have COVID 19. Meanwhile, the district office conducted another proactive screening session today on 500 people, from subcontractors for Italian to vendors in 6 markets at a construction site near Jalapan Hospital.
We're still on the issue of the COVID-19 vaccines, especially with the mass inoculations. Previously, we had to apply for our vaccination through Prom applications. And recently, the Bangkok Metropolitan Administration, or the BMA, will open new channels for COVID-19 vaccination applications starting this Thursday. Bangkok Governor Aswin Kwanmueang said that people living in Bangkok aged from 18 to 59 who are not among people afflicted with any of the 7 non-communicable underlying diseases can apply to receive vaccinations through 3 channels from Thursday. So the first channel will be this website, www.thairuomchai.com. It is in Thai for the Thai Ruomchai word, or through the Bao Tang application for those who have already applied for state subsidy schemes and have already installed the app in their smartphones and who do not need to fill in application forms. They simply state their wish to be vaccinated and wait for an SMS confirming the appointment. Those who have deleted the Baotang app can apply through the thairomjai.com website. People who have not joined any state subsidy scheme can apply through the website and will receive confirmation of the vaccination appointments by text message. There's also another channel which is for those who do not have a smartphone. So they can use their ID cards and apply at any convenience stores such as 7-Eleven, Family Mart, Tops Daily Mini Supermarket, or Mini Big C. And you can apply from 8:30 a.m. up until 6 p.m. Or they can actually ask one of their family members to apply on their behalf through the website. Governor Aswin said that the new channels will provide wider and more convenient public access to the vaccines, which will hopefully help in the containment of the pandemic. Additionally, he said that City Hall, with the cooperation of mobile phone service providers, has opened a call center with the phone number 1516 with 450 lines open from 8 a.m. up until 8 p.m. daily to receive calls from members of the public who may have questions about the vaccination application process. So may I repeat the hotline again is 1516. If you have questions about the application process or to get an appointment for your vaccination, you can call this number.
Well, actually, that seems simple enough, especially I like the idea of convenience stores as well. We can do a lot of many things, paying bills at convenience stores these days. So why not vaccination? And still on the topic, Thailand's Food and Drug Administration, or FDA, now revealed today that China's state-owned company Sinopharm has submitted all the necessary documents to seek approval for the use of its COVID-19 vaccine in Thailand, and with a decision expected soon. Biogenetic is the biopharmaceutical firm which will import the Sinopharm vaccine. If it is approved, it will take no more than 30 days for experts to review the vaccine's quality, safety, and efficacy, said FDA Secretary General Dr. Paisan Dankum. Two other vaccine brands are also in the process of submitting documents to apply for approval for use in the country, namely India's Covaxin and Russia's Sputnik V or 5. Currently, Thailand has approved the use of AstraZeneca locally produced by Siam Bioscience, Sinovac, CoronaVac, Johnson & Johnson, and Moderna vaccines. Earlier this month, the World Health Organization approved the use of Sinopharm vaccines for emergency use, joining Pfizer, AstraZeneca, Johnson & Johnson, and Moderna. Prime Minister Prayut Chan-o-cha also said yesterday that the WHO's approval of Sinovac is expected later this week.
Now, we've been talking about quarantines a lot, but it's either home quarantine or in state quarantine, where the latter may not sound so comfortable for everyone because we've been hearing complaints that they've been put into state quarantine that is not really up to standard. This is where another option comes in, which is called alternative state quarantine, where you can stay in hotels. So we're going to take a look at how Thai hotels changed to ASQs to survive and provide quarantine with comfort. Let's find out more in this report by Kun Tulip Nak Sumpop Lao.
It used to be hard to imagine the word quarantine would come up in conversations about travel. That was until 2020, when quarantine and isolation became familiar to most people, if not by having to be in one, then with the concept at least. Thailand has a program whereby hotels can be part of the quarantine system. Though there are state quarantine facilities provided for incoming Thais, some people want something a little more comfortable for their 14 days of confinement. This is where alternative state quarantine or ASQ comes in. There are currently 137 hotels in Bangkok alone participating in the program. This does not include what is called alternative local quarantine or ALQ in popular tourist locations such as Pattaya, Phuket, or Samui. Bangkok has about 18,000 rooms available, and the occupancy rate now is only at 50 to 60%. 137 hotels sounds like a lot, But there are many hotels out there which decided not to join the scheme, partly because the process of turning the hotel to be a quarantine facility is not easy. The president of ASQ-ALQ Thailand, Ekachai Sikurecha, told Thai PBS World that it can take up to 8 weeks to convert a hotel, and everything about the process is challenging.
It usually took us around 3 to 8 weeks to prepare the hotel to meet the Ministry of Health standard and requirements, and the hospital partner will come in to inspect and train all the staff to meet the standard. The training takes place for 3 to 5 days prior opening. Everything is difficult overall. It's pretty difficult to maintain and to run the ASQ hotel. There are many different small things which have to be looked up for and looked into it to make it successful.
Ekachai said that the changes and the preparation are also expensive. Basically, all the rooms have to be refurbished to meet the criteria of both the Ministry of Public Health and the hospital, which each hotel partner with. On top of that, in an attempt to keep their guests entertained, some hotels provide yoga mats, dumbbells, and other fitness equipment, or even PlayStation.
We have to remove the carpet, or we have to cover the floor with the plastic to avoid all the dirt to fall into the carpet. And there's a ventilation system, the aircon system will be tested and be rechecked by the Ministry of Public Health, and the water drainage system and the sewage system. We have to meet all the standards required by the hospital partner and the Ministry of Health of Public.
The day Thai PBS World met Ekachai, he was attending part of inoculation campaign for ASQ hotel staff, one of the measures which will help staff build up their immunity and provide them with a greater level of safety as they work on the front line to welcome and care for the arrivals. Thailand began rolling out its national inoculation program at the end of February. So far, however, less than 5% of its population has been vaccinated. The public health minister said that they hope to be able to inoculate 70% of the population, or 50 million people, by the end of the year, including foreigners in Thailand. Since April last year, the hotels in ASQ program generated 2 billion baht in revenue for the country already, a number that Ekachai said everyone in the hotel industry worked hard to achieve. Ekachai said when the quarantine period was reduced to 10 and 7 days several months ago, it got them all excited about welcoming tourists back. But with the current surge in COVID-19 cases resulting in a return of 14-day quarantine might stop people from coming. It's a tough time, he said. Ekachai hopes the country will be able to open for tourists in October this year, given most people in Thailand should be vaccinated by then. Tulip Naksompoplao reported for Thai PBS World.
So definitely ASQs is definitely another good option for those who want comfort, although you may have to pay a little bit extra to get that comfort. But for some people, if they want comfort, it would be better for them instead of risking or have to double guess whether they might be put into state quarantine that may not have enough facilities for them to survive through the 14-day isolation.
Of course, that definitely is a good option for those who can afford it and who wouldn't want comfort. So moving on now to economic situation impacted by COVID-19. Pak Khlong Talat flower market is actually well known as Thailand's biggest market for fresh cut flowers from across the country, even from other parts of the world, such as the Netherlands. Any kind of flower you can imagine, from colorful orchids, lilies, and jasmine to Dutch roses and tulips and floral arrangements, are available at the wholesale and retail prices. But since its closure on May 22nd at the order of the Bangkok Metropolitan Administration to prevent the spread of COVID-19, the market has become a ghost town, especially at night when it used to be energetic and bustling with vendors, workers pushing push carts loaded with fresh cut flowers being unloaded from trucks, and customers looking for the freshest blooms. Dekapet Road, which used to be lined around the clock and flower stalls on both sides, is now deserted. All that is left are a few tents, manned by city police, erected to enforce the closure. Some vendors say that they have had to improvise by selling online or by delivering to make a living, adding that they have no idea when the market will reopen because the BMA only announced the market's closure until further notice. A few vendors who are also orchid growers complain that the market closure is like a double tragedy for them because they cannot export their orchids and now they cannot sell the flowers locally either. Other vendors say that since they are mostly middlemen, they are not as badly affected as the flower growers who have to cut their flowers when they are about to bloom or leave them to wither when they cannot sell them. However, many vendors suggest that the BMA should vaccinate vendors and workers so the market can reopen quickly after infected people have been separated. During the closure of the market, city officials have been conducting a census on the number of vendors and workers at the market to enable proper management and to prevent illegal immigrants from working there who may unknowingly be carrying the virus. An active screening of over 2,500 people at this market and other markets in Bangkok, as well as nearby communities since May 7, have found 262 infections, including 88 Thais and 174 foreign migrant workers.
So we can see that the COVID-19 situation has put a huge effect on many of the markets, especially in Pak Khlong Talat, which sells a lot of flowers, and especially during special occasions, they make absolutely a lot of money during those times. And when the COVID-19 pandemic came in, they had to suffer a lot because they could not sell any of them.
Yeah, that's really sad indeed, and also synonymous. What can be illustrated through the market is actually what's happening in the economy overall.
Exactly. And that's all the news we have for you with this edition of Thai PBS World Tonight. You can check out the latest news, whether it's COVID-19, politics, and other news on our website, thaipbsworld.com. And you can also follow us on Facebook, Twitter, YouTube, Instagram, and TikTok. And that wraps up tonight's edition of Thai PBS World Tonight. Thanks for watching, stay safe, and we'll see you tomorrow. สวัสดีค่ะ
Have a good night.